Good morning. Welcome to the Evergreen Senior Center in the best town around, the township of Woodbridge. It is our great pleasure to once again welcome Congressman Frank Pallone to Woodbridge, and I say once again because it seems like he's here all the time. He comes to events, he comes to parades, he comes to flag raisings, he comes here for technical reasons like this press conference here, where he's going to talk about helping seniors in the state of New Jersey and in the country with some of the great things he's doing there. Before we start, I want to introduce some of the people from Woodbridge that are here today. To my left, the people that won't be speaking, which is usually good news. Chief of Staff and Head of Redevelopment, former Councilwoman Carolyn Ehrlich. Another former Councilman, Charlie Kenny, who's now Middlesex County Commissioner. The head of our Senior Services Department, which we established several years ago, recognizing how important seniors were to us. We broke it away from the Health Department and gave it its own director, and that's Michelle Morgan. All right. We have Vito Samaluka, our Business Administrator. Sorry, Vito, not as much applause as Michelle Morgan. The head of our Senior Transportation, Diane Mantegas. There we go. The assistant to Michelle Morgan, Renee Santos. We have our Middlesex County surrogate, Clarabelle Cortez. Our Health Department Director, Mr. Phil Bajowski. Our Chief Health Officer, David Kolodziejski. We have Valerie, and I see some other employees. I don't see some other employees. But anyway, Billy's in the back. Our press head, our communications director, John Haggerty, who put this event together on very short notice. His assistant, Megan Kushbitz here. So let's hear for the Woodbridge Township team. And now it gives me great pleasure to turn the microphone over to our congressman, who's going to explain the great things that he is working on in Washington for the residents of New Jersey, and as I said, the United States of America. Ladies and gentlemen, our good friend, Congressman Frank Pallone. Okay, good luck, make sure you hold it close.
All right, thank you, Mayor. I'll remind all our speakers to hold the mic close. First of all, thank you, Mayor, and also all our elected officials here in Woodbridge Township and in Middlesex County for being here today. I always appreciate coming to the Evergreen Senior Center. I know there are other senior centers around, but this is the one that it seems like you have the most events at least when I'm here.
Yes.
So I appreciate that, I really do. But anyway, the reason I came today is because we have a piece of legislation that's moving in the House of Representatives, and it is bipartisan, and I want to stress that because if you're paying attention in the media, particularly in the last few weeks, you'll probably see all kinds of fights in the House and, you know, what are we really doing in Washington? But the fact of the matter is that we do a lot, and there's still things that we do very much on a bipartisan level. So what I'm talking about today is something that came out of our committee, the Energy and Commerce Committee, where I'm the lead Democrat, unanimously. All right, in other words, everyone was for this, whether they be Democrat, Republican, regardless of what part of the country they're from. So I want to stress that because it really is important that you understand that. Now, the most important thing I think that you can relate to that's in this bill, which is called the PATIENT Act, it kind of comes back to a few years ago when I was actually at a senior center. And a gentleman got up and had gone around to a couple of the hospitals in my district in Middlesex and Monmouth County and had actually asked the hospital for price information about various items. In other words, how much they were charging for a particular item. And the one thing that galled him the most was for an ice pack, which might sound crazy to you, like how important is that? But he had compared different prices that hospitals had charged. And they went anywhere from $2 to $200 for the same ice pack. And I tell this story because it kind of illustrates the fact that, you know, we don't really know what they're charging for. And then we had a hearing on this issue, again, a couple years ago. And the representatives from the hospital organization, I did the same thing. I showed them the information, the two different hospitals in the district on the cost of an ice pack. And I said, well, how is that possible that one of you is charging $2 and one's charging 200? And then there were others in between, by the way. And he literally said to me, he said, well, those prices have nothing to do with what we actually charge. When a patient asks for a bill, we look at the overall bill and we tell them what it is, and then we assign numbers to the various items. So basically, he was saying it was meaningless. It was meaningless information. It wasn't in any way related to what they actually charge for the ice pack. Now, a lot of you are going to think, how's that possible? But I mean, I didn't bring the record with me, but I can prove to you that what I said is true because this is what he said. So over the years, there have been a number of groups that have been very concerned about the fact that we don't know how much hospitals are charging. We don't know how much insurance companies are charging. We don't know about inpatient versus outpatient rates. We just don't have that information. And I've always been an advocate, some of you probably remember Senator Lautenberg. Senator Lautenberg was U.S. Senator for many years, and he always championed the idea of what he called right to know, meaning the idea that the only way that a consumer can really be an advocate and be able to assert their own rights is if they actually knew what was going on. The right to know. So to me, the PATIENT Act, more than anything else, I've already spoken too much, but I want to say that the PATIENT Act, more than anything else, provides consumers with a right to know, with the theory being that if you then can compare, not only you, but anybody, can compare prices, then that ultimately creates competition and brings the prices down. That's the whole idea. So let me just tell you briefly what this does with regard to both hospitals and insurance companies. It requires hospitals to make public all standard charges for items and services and to display charges for the hospital's 300 most shoppable services in a consumer-friendly format so that you can see it. Then with regard to insurance companies, they have to make public their negotiated in-network provider rates for all items and services. In other words, how much they're essentially charging for those services. Bill charges for out-of-network items and services, and personalized cost-sharing information. So as you know, sometimes the hospital's in the network, sometimes the doctor's in the network, sometimes they're out-of-network, different charges in and out-of-network. And then also what you're paying. What is your copay for these different things? And all of that has to be readily available. Now, you know, you're probably going to say, how are you going to effectuate this? Well, believe it or not, we have bipartisan agreement in our committee, and hopefully move this to the House floor and get the Senate and the President to sign it. So that's the most important thing. But I do want to also mention a couple other things that's done in this legislation, and I'll try to be brief. Second thing is, I don't know if you know what we call private equity firms. I just call it Wall Street, right? What is happening is more and more private equity firms, in other words, Wall Street firms, major corporations, right, are purchasing hospitals, right? And we believe that that's driving up costs because their goal is to make a profit. Yeah. So what we do in this bill is we say that that has to be disclosed. In other words, the hospital has to say who owns them, whether there's a private equity firm that owns them, and what their interest is. So that's number two, and I mean, that may not be as significant, but I do think it's significant. Then it requires that what is charged, I don't know, have any of you noticed how more and more now doctors are, their offices, their practices are owned by hospitals? Have you noticed that? In other words, that what used to be a private practice is now hospital-owned. So it'll say, for example, Robert Wood Johnson or St. Barnabas System or Hackensack Meridian System. Well, that's what's happening a lot. And a lot of the reason for that is because hospitals are finding it very lucrative to purchase private practices. I don't know if I don't think it's a good thing, but you know, you can decide whether you think it's a good thing or not. But one of the reasons for that is because oftentimes when we reimburse doctors for Medicare services, there's a different rate for outpatient hospital services versus outpatient services that the doctor performs. So in other words, let's say you went to JFK Hospital, right? And they have an outpatient place where, you know, you go for surgery or go for something, tests, whatever, right? And they will get paid more by the federal government under Medicare for a drug, right, that's administered to you, than if you go to a doctor's office and they administer on an outpatient basis the same drug or the same service. You follow me, what I'm saying? All right? And so that creates an incentive, if you will, for the hospital to purchase the doctor's practice because they can get paid more than the doctor can. And so, but the point is, regardless of whether that's, having these doctors' practices owned by hospitals is a good thing, the bottom line is, why would we be paying more to the hospital for the same service that's being paid? Because these are not like, things that are highly specialized. These are just basic tests in many cases, or a basic procedure that it doesn't really matter whether it's performed in the hospital outpatient facility versus the doctor's office. So one of the things that this bill does is says that those have to be the same. We're not going to, for drug purposes, we're not going to give the hospital more money than we're going to give the doctor in an outpatient facility that he has for the same drug. We're not going to allow it. And we think that that's only fair and saves the government a lot of money and ultimately saves you money because it drives up the cost, but also probably discourages hospitals from just purchasing these doctors' practices only because they can make more money. I mean, I don't know. It's a little complicated, but I hope I explained it. Now, let me just talk a couple more things, and then I'm going to sit down here. But the other thing that that you may or may not know is that we have in our district, most of the hospitals, I should say many of the hospitals, like for example, St. Peter's is an example, that are what they call DSH, or disproportionate share hospitals. In other words, because they handle a lot of people that are relatively poor or low income, they get paid more money by the federal government. And so we need to come up with a way to continue to pay for that, because there's a constant effort to cut back on that money because it costs the government a lot to help these hospitals continue to stay afloat. So one of the things is a lot of the things that I'm talking about today, because they save money to the federal government, allow us to pay for the disproportionate hospitals like St. Peter's so they don't go bankrupt, all right? I mean, I know you may say, well, what do we care? But if we have a lot of hospitals closed, as some of you may remember Muhlenberg Hospital in Plainfield that closed. We don't want to see more hospitals closed because then there's less opportunities. But the last thing I wanted to mention, and this applies primarily to Medicaid and well as private insurance. Have any of you heard any of you know what a PBM is, a pharmacy benefit manager? Any of you know that? Well, these are sort of middlemen, if you will, or the groups of middlemen that basically buy drugs, if you will, from the pharmacy companies, and then they discount it because they have so many, because they're able to buy wholesale and pay so much. To the cost to the insurance. So insurance companies hire them in order to get a better rate for their drugs. But what we have found is that these PBMs, or pharmacy benefit managers, oftentimes don't reveal how much money they're saving. And so they keep the difference, and essentially it becomes more of a cost to the consumer because oftentimes they're not saving as much money to the insurance company, or to Medicaid for that matter, as they should. So what we've done is we've also created a transparency provision here that says that those PBMs have to tell Medicaid and they have to tell the private insurance companies how much money they're actually making, so that again, that we don't see these huge drivers of increased costs for your prescription drugs. Now that's really getting into the weeds, but I just want to point out that there's a lot going on in this bill that is designed to make things public, provide transparency, and then ultimately lead to a situation where costs go down and seniors and everyone really pays less for various healthcare measures than they're paying now and what they should pay. So now, the groups that I'm going to introduce, or the representatives from various groups I'm going to introduce, are all different organizations that have been very concerned over the years about lack of price transparency, the fact that the consumer does not know what actual costs are for healthcare. And the first person I'm going to introduce is the co-founder and chairwoman of a group called Power to the Patient. You see their sign up there? I mean, I don't know, Cynthia, it almost looks like some kind of a socialist, communist thing or something. But I assure you, that's not what it's about. Cynthia and her group, Power to the Patients, are all about trying to provide more information to the consumers so that they bring down costs. And she's the founder and the chairwoman of this organization, came all the way from Boston today, where she lives, to be here with us. So if you'd come up, Cynthia, I'd appreciate it. Open up, folks.
I'm going to shake your hand with you. Thank you, Congressman Pallone, and Ranking Leader Pallone, who, as former chairman, has just been unbelievably strong, leading to codify the rules that give us all the right to know all actual prices in healthcare from wherever we get care, and holding hospitals, insurance companies, drug companies, and, as he said, all the many middle players that capitalize on our health misfortune accountable. This is a first. It's really revolutionary. I was a CEO for a health price transparent, quality transparent, and outcome transparent company to bank stem cells as an alternative to bone marrow from umbilical cord blood over 30 years ago. So I know it can be done, and I know that as a healthcare entity, I could deliver at 1/6 to 1/10 the cost of my hospital competitors and provide a gold standard by doing the right thing and charging everybody the same price and saving them all money and giving them financial certainty. And today, what we've seen is so many of you, and I have another organization, another nonprofit that we have analysts and lawyers that look at the health data, and it's called patientrightsadvocate.org, and we fight for patients on their medical bills. We've won 100% of the time. Why? Because people have been blatantly overcharged wherever they get care. We went across the country 5-6 years ago and surveyed Americans like yourselves. And what we learned from seniors was, we're kind of always parents, aren't we? We never give up worrying about our kids. What we learned from seniors that were on our Medicare system is even they were getting surprise bills. And every bill is a surprise if you don't know the price. When you have prices, then you can know whether your bill is correct or not. There are 100 million people in this country with medical debt. And many of them are probably your family members. And I bet if I asked you all to raise your hand on how many of you have had a family member or yourself been overcharged by healthcare from a medical bill. How many of you have been able to successfully fight it? Just a few. But now that we can see prices from this bill that is so unanimously supported right now in Congress to solidify our right to have all of these prices, which came out of both Obama, Trump, and Biden administrations as administrative rules, but Congressman Pallone wants to make sure that it doesn't go away, that it's here for us forever. That means the 100 million people that have medical bills and might even be having hospitals sue them to garnish wages or put liens on their houses for overcharged medical bills actually have the right to know whether the prices were true and whether that's the exact amount they should pay or not. And when we can see that even in the same hospital on the same day, there's wide price variation. We're seeing that one patient gets a dosage of injection of Rituxan for $800, and a Cigna HMO plan is charging $9,600 for the same injection of the same drug. even patients on Medicare, we're starting to pull back the data, and we're seeing a pill that should cost 30 cents is being charged over $300 to a certain Medicare plan per pill. So now that we're starting to pull back the curtain and see price transparency, we're seeing this wide price variation, and we'll have the right to know what is a fair market competitive price for things like a strep test, which frankly on Amazon you should get it for $20. But people don't know. The same ACL repair brace on Amazon, $150. But the brace shop in your hospital may charge you $1,500. You have the right to say, no, I'll get it from Amazon, it'll get delivered in 6 hours. Right? This is our right to save our own money. So this is huge, and what we found in surveying the country is even senior citizens across the country lost sleep at night over healthcare. And why was that? They knew that they worried for their children, their adult children, their grandchildren, that might not have had access to the best quality care at an affordable price, and had imbalances even within their own family based upon where they worked or what their jobs were. And this price transparency is going to be the great cure to the first step to allow for non-discriminatory practices and prices, and put the money back into the American worker, the American taxpayer, and all of us, to keep our own wages not going to coverage costs and not being taken our savings because we're way overpaying for healthcare. This shifts the power, and that's why we have that fist up there. It shifts the power to all of us. It gives us the power to speak up. It gives us the power to fight those medical bills that aren't correct. It gives us the right to choose to be protected from the overcharges of healthcare, and at the same time start to allow the free market to take place and be able to save our money and get that MRI for $300 at a standalone imaging center, rather than paying over $3,000 in the big hospital system for the same quality of MRI. That's huge. That's what everywhere else in our American economy, we're empowered. We know how to shop, and we know how to save our own money, and we know how to fight bills that aren't true. So this is a great moment in time, and I'm so honored to be here. And I can say, Chairman, former Chairman, Ranking Member, Leader Frank Pallone has been instrumental in delivering this to our country, and we look forward to supporting him in getting his bill passed through Congress to ensure this never goes away, and we take on the power to be protected, lower our costs, get better access to care at a far lower price. So thank you very much.
Thanks so much.
Thanks.
You said it a lot better than me.
To be perfectly honest, thank you. So now we have Kevin Mora, who's also with Power to the Patients. He's done all kinds of TV productions about this. Well, I'm not going to say anymore. You're bringing up the sign with you, I say. All right.
Thank you very much. A real pleasure to be in front of you today in Woodbridge. My name is Kevin Mora. I'm by career a producer and a director, and many of the projects I've done have ended up in your living room on television sets, but some of the more profound work I've done is in documentary. And we filmed all across Africa and in Israel, throughout Asia, Northern Ireland, in a post-Katrina New Orleans. And I say that to say this, I consider myself a humanitarian above all else. And I think that to consider yourself a humanitarian, it's sort of a constant amount of work one must do for the benefit of all of us, right? And it's very boots on the ground. And sometimes these doors, these opportunities just open up for us to enter, and we do what we can to prevent struggle from our neighbors, from ourselves, from our family, and we do work towards a greater good. For me, several years ago, we had just finished a documentary, and my brother and I were at the Sundance Film Festival, and we were sharing a hotel room. And I woke up at 2 in the morning, And for the first time in my life, I felt really, really sick, really ill. There was like some volume of a static, kind of a white noise that was escalating in my ears. My vision became very blurry, and I woke my brother up. This was 2 a.m. I said to my brother Paul, call 911. Call 911 because something is wrong. I think I'm having a stroke. I was a young guy, but something was really wrong. So he calls 911 and he's getting me some water and things are just not right. In a matter of minutes, 7 handsome, strong gentlemen come vaulting through the door. And in that moment, the only thing I could think about suddenly was not my health, but the fact that I didn't have health insurance. And all I could think about, I was this producer, I was a young guy in my 30s, but I had saved a certain amount of money to eventually buy a house. And these guys came in and they had this stretcher and they were taking my vitals and they said, we're bringing you to the hospital. And all I could think about is, wait, how much does that cost? Really? And it's this horrible crisis one has, when all I should have done is slid myself with their help onto the stretcher and off I went. But I thought, geez, I hear all these horror stories for years about medical bills and overcharges. How much is this going to cost? So I said to the gentleman, I said, how much is it to ride in your ambulance? And in Park City, Utah, it's a free service provided by the town. So I win right there. But I said, how much is it going to cost me to get evaluated in the hospital? And they couldn't answer this. And so I said, well, give me a range. Is it $10,000 for an overnight stay? Is it $50,000? Could it be $100,000? And all my savings is wiped out and I'm put in medical debt? And they said, we don't know. And I said, is it 10,000 or 100,000? And they said, we can't tell you, sir. We do not know. And I'm in the midst of thinking I'm having a stroke. And I said to them, and this was a rational decision I made in my mind at the time. I mean, most people say, just go, it doesn't matter what it costs. But I said, I've worked so hard. I've saved diligently. I'm not a wealthy person. I don't want to risk all my finances if maybe this isn't a stroke. Maybe this isn't going to kill me. And I told them, I'm not going anywhere. And I watched 6 strapping EMTs leave my hotel room, the door closed, and my brother's looking at me with his mouth down to the floor saying like, are you sure? And I said, I just don't know. And I settled in for the night and I took my chances. And I say that to say this. What hospitals and what healthcare has done in this country, the greatest country on planet Earth, is made these non-discretionary choices, these necessary decisions that we have to make for our health and for our lives. They've made them discretionary ones. They've made us make those choices. Do I go to the hospital when I think I may be having a very severe health situation or not? And I chose not. So we talk about the lack of transparency a lot of times as an economic issue, and it is. But it's also a humanitarian one. In the United States, to have somebody decide they don't want to go to the hospital is a real problem. It's a fundamental issue that we have in the United States. This is capitalism out of control, right? These hospital executives have so much need for profit. They're under a lot of pressure, oftentimes because their own salaries are enormous. We see in New York City some of these non-profit hospitals that unknowingly we hold so high. And then we find out the CEO is making $15 million a year. Some of these non-profit hospitals, the CEO is making $25 million a year. And how do they do that? They do it by hiding their prices. To Cynthia's point, to charge $300 for something that should be 30 cents is a great way to create a salary of $10 million for yourself. And that's what they do. My mom, my own mom, who is a similar age to many people I see in this room, was literally dying of cancer on a bed, and we needed a prescription medication. And I'm on the phone trying to whittle down what was gonna cost us $13,000 a week for a medication that would allow my mom to eat. Without it, she could not eat. And we're faced with this decision, like, do we get this or do we let my mom suffer? This is a lady who worked her whole life, saved her whole life. Suddenly she's put in a position where, do you want to go broke in your final days? There was no saving her, but it was alleviating some of the pain and some of the struggle. These aren't decisions that we should be making as Americans. So I see a lot of wonderful faces in here, and I'm sure a lot of you have lived very responsible lives. You've worked hard, or your partner's worked hard, and you've saved money. We should never be in a situation where, based on our health or our lives, we have to make a decision that could cost us all the money we've saved, that could determine I can't move into another place, or I have to now move into a smaller apartment, or maybe a son or a grandson, granddaughter can't go on to college. So again, what the hospitals have done, what the healthcare system has done, is made these necessary decisions. They've made us make a choice. And you see this certainly in more marginalized communities. It's very visible in towns like Newark, Patterson. You see people that are limping down the street for 30 years. And you might go up to this person and say, like, why don't you get this fixed? And they've made the rational decision for 30 years. I will not go into a hospital. I cannot afford it. Because we cannot see prices. We cannot shop. There is no competition. This is a humanitarian issue. And there's wonderful, wonderful people working on this issue. Certainly, Cynthia Fisher has done wonders all around the country. Congressman Pallone, what he's leading in Washington, D.C. is incredible. Chris Deacon, who's in the front row here, knows more about this issue than anybody I've met. She's incredible. There's so many people they're saying, not on my watch, and that's crucial. I want to talk about this artwork very quickly. This was created by a very famous artist. His name is Shepard Fairey. His work is in the Smithsonian. It's all around the world. He's a street artist. He is type 1 diabetic, and his wife suffers from MS. He knows all too well the results of hospital overcharges and people refusing to go into hospitals for preventative care, et cetera, et cetera. The fist, although it's been used in communist propaganda, is just a sign of righteousness. We're fighting the system. Nelson Mandela famously held up his fist, fighting a system that is so rigged against us that this is the equivalent of a movement, because we need it, and we need everybody to talk about it. So that's why the importance of your voices leaving here today is to let your neighbors and your friends and your family know. There is now a federal rule. We have the right to prices at every single hospital in this country. And we lean on our leaders in Washington, D.C. to help us codify and prevent these egregious overcharges, the lack of competition. We need unions like 32BJ to have the opportunity to negotiate with hospitals. You can't negotiate with somebody if you don't know their prices. So I want to thank you. Oprah Winfrey once gave away a bunch of cars. You get a car, and you get a car. Well, you all get posters today if you want to. I really appreciate being here in front of you all at Woodbridge and being here at the Senior Center. And we are fighting for you. Please help spread the word. Prices are now a patient's right. Thank you all so much. Really appreciate it.
Thank you, Kevin. I'm thinking that I probably shouldn't have said anything about the poster.
But if you think about it, competition is the essence of capitalism, right?
I mean, in other words, capitalism and a market economy can't exist unless there's competition. So, you know, I would argue that this poster is almost the opposite of socialism, right? Because we're basically saying we've got to bring back a market economy and a competition, which is true capitalism, in order to accomplish our goal with price transparency. So let me go now to, we have two more speakers, and they've done a lot of this work on the state and local level, so I do want them to say a few words. Next is another Kevin Brown, who's New Jersey State Director for 32BJ of the Service Employees International Union. Come on up.
Thank you, Congressman. Thank you, Mayor McCormick, council members. Very important issue that I think is just beginning to get the attention that it so desperately needs. So why a union guy? Why a union guy here to talk about this problem? Well, as the previous speaker said, when we go to negotiate a contract with our employers, and we have to put so much money into health care because the price of the hospitals is so high, what does that leave us for wages? Not too much. And what's the most important thing that all our members and all working people care about? How much money is going to go in your pocket? And if all your money is getting sucked down because of the prices for healthcare, and most of that because of the hospitals, you don't have as much money left. So part of that problem is we don't know what we're dealing with because we don't know what the hospitals are charging. Now, there is some information already that's available. But the problem with that information is, first of all, it's all kind of messed up. When you get it, you can't really tell what's there. This bill helps to fix that. The other problem is that if they don't report it, which many of them don't, they just ignore the current regulation to provide the information, so they violate the law, there's very little penalty for it. This bill would actually make them pay. And that's the only way that they're going to actually do what they're supposed to do, unfortunately, for the hospitals, is if they have to pay if they don't do what is required under this regulation, and hopefully soon will be law. Those are very important parts of this bill. You know, we are looking at prices all the time, and I love that everyone has their own story of which one they want to compare it to, whether it's an ice pack or whether it's, you know, you're in a crisis situation. The story that we like to use a lot is, it brings a smile to everyone's face, is to compare colonoscopies. See, it brought a smile to your face. It turns out in New Jersey, you could go to one hospital and we have to pay $12,000 or $14,000 for a colonoscopy. And then another hospital in New Jersey will charge $3,000 or $4,000 for the same colonoscopy. And you know what? The one that charges $3,000 and $4,000 may actually get better results. They're doing a better job in that colonoscopy than the one that's charging $12,000. How does that make sense? Well, it doesn't make sense. And what results is that we have to pay a lot of money, our health fund, for this health care, but we don't always know what these prices are. And this is the first step, that transparency, to be able to do that pricing. The other thing that the Congressman mentioned, which I want to highlight, is all these big corporations. Anyone ever know Summit Health? Well, Summit Medical Group now is Summit Health because they merged with CityMD. They bought up another practice before that. I was there this morning to get some blood work done, and they stuck me 4 times, including right here, to try and find my vein. I was thinking, are they going to charge me 4 times for that to get my blood work? I don't know, but they have turned into a huge corporation, Summit Health, because they are financed by private equity. Billions of dollars now. What was a very small company in Berkeley Heights has grown to this mammoth New York, New Jersey company. And we need to be able to know where that money's coming from, who are these people who are buying it, and this bill will help to do that. So that's also very important and will help us to be able to understand the situation. And then what the next step after we have the information, and reliable information, after this passes in this law, and we can then use it to make better decisions. when we're purchasing healthcare. And one hospital refuses to lower their prices to our health fund, such as Columbia Presbyterian refused to lower their prices in New York City for our New York City members. You know what we said to Columbia Presbyterian? You're out. Because that's sometimes what we have to, and a lot of members love Columbia Presbyterian. But in the end, if we're not willing to make those sacrifices so that we can say, if you're not going to lower your costs, we're paying way too much money, then we're going to have to do some real tough decision making. And the first step of all that tough decision making is being able to have that information. And getting that is what this bill will do, and we really thank you, Congressman Pallone, for this. Thank you all for coming here today, and let's get this done and make some law. Thank you.
Thank you, Kevin. And last but not least is Laura Waddell, who's the healthcare organizer for New Jersey Citizen Action. Now, New Jersey Citizen Action does all kinds of things for consumers that they've been involved with over the years. So thank you for all that you do.
Good morning, Evergreen. And thank you so much, Congressman Pallone, and all of the folks up here with me today. I've had the pleasure of speaking here once before with Congressman Pallone, and I'm so happy to be back. Thank you for having me. Today is really about choice, affordability, and accountability. Here in New Jersey, consumers continue to struggle to afford health care, as we've heard. A study released earlier this year showed that 57% of New Jersey respondents experienced a healthcare affordability burden within the past year, and 85% worry about affording healthcare in the future. Another study showed that over half of New Jersey respondents are not confident in their ability to find out the cost of a procedure ahead of time. We're also seeing how affordability and transparency issues are leading to widespread medical debt, which represents 58% of all debt in collections nationally. Many patients don't have the pricing transparency they need to be informed healthcare consumers, and so are prevented from making the best decisions for themselves and their families. So instead, they're getting saddled with debt they can't afford, and things just spiral from there. At New Jersey Citizen Action and through the New Jersey for Healthcare Coalition, we continue our work to make healthcare more affordable and accessible and to improve the quality. And an important step in the journey to making things better for all of us is to better understand the healthcare cost drivers and give consumers and employers choice by strengthening transparency. The Transparent Price Act will make hospital pricing and coverage transparency settled law and provide additional improvements that will help patients to be more informed consumers of their health care services. Transparency paves the way for affordability. Progress on these fronts is constantly under attack by big interests. So we must stay vigilant in keeping the needs of New Jerseyans at the forefront of our efforts to advance as well as to defend the gains we've already made. We see these attacks as we continue to defend the Affordable Care Act and the Inflation Reduction Act. And we see them when Big Pharma continues to fight us tooth and nail to keep their profits high at the expense of consumers. Just look at what Merck is doing right now to try and stop the implementation of Medicare negotiations for our seniors. If Big Pharma is doing this to our seniors, then we need to use every means at our disposal to bring pricing reform that will help all of us to our state and our nation. Skyrocketing healthcare costs need to be reined in because New Jerseyans are delaying or going without healthcare due to cost, and they are struggling to pay their medical bills when they do get care. We're being exploited by a system that lacks transparency for treatment costs, additional meaningful pricing guardrails, and cost reduction measures. Hospital pricing in particular has been a key driver of healthcare costs, and New Jersey residents have been feeling the effects. 74% in fact think hospitals are charging too much money, and that tracks nationally, showing hospital prices have inflated at nearly 90% over the last 20 years. That's why we need to call on Congress to pass the Transparent Price Act, because the status quo, it's not working for New Jerseyans, and healthcare costs from prescription drugs to hospital care and treatment have been going unchecked for far too long. We need to support Congressman Pallone and urge the rest of our New Jersey congressional delegation to support consumer choice, affordability, and accountability in healthcare too. Thank you.
Thank you, Maura. And we're going to end, but I just want to say, I know that in the course of our presentation today, we've criticized hospital execs, we've called out Merck, which is down the street. I'm sure there's some people here who work for Merck. We talked about Columbia Presbyterian. It's not that we're against any of these. We understand the importance of hospitals. We understand the importance of drug companies. But the bottom line is that we're seeing all these abuses, and we're seeing how those abuses affect all of you, and how they really create almost a monopoly in a free enterprise system. And the only way that we can correct that is through congressional action, government action, to kind of step in and say, look, you can't do this, you can't go this far. This is having a negative impact on our healthcare system and on the individuals and on the patients. So just understand that we're on your side, and we're going to do whatever we can to get this passed. And I'll conclude with this. This is something, I don't come here, I don't know how to say this nicely, but I don't come here and bring you all here and ask the mayor and the county commissioners and the county elected officials to just come for something that doesn't have a chance. We have a very good chance of getting this passed and signed into law, and that's why we're here today. So thank you very much. Thank you.